Hi everyone, my name is Chelsea and I'm the Youth Coordinator for Rare Youth Revolution. Today I will be speaking about engaging with young people in healthcare. Before I get started, I would just like to introduce who we are. Rare Youth Revolution is a platform that amplifies the voices of young people affected by rare diseases through article writing, social media campaigns, video content, and advocacy. So, what is engaging young people in healthcare? It is involving us in our own healthcare. This involves things like telling us information relevant to our condition, such as available treatment options, and letting us take part in decision making processes regarding our own health. It is also about communicating with young people effectively, talking to us like people, and building a relationship with us that enables trust. So, why am I speaking about it today? Engaging young people in our own healthcare is important for multiple reasons. Firstly, it gets us to start caring about our own healthcare. If healthcare professionals don't engage with us successfully, then we won't engage in our own healthcare. Secondly, it sets up a relationship with us. It is important to have this relationship so we feel comfortable about talking about our own health with healthcare professionals. It provides trust. By providing trust, we will feel more comfortable in the environment surrounding us. It will allow us to be more open about how we are truly feeling about our own health and be willing to talk and discuss it with healthcare professionals. Effective engagement helps figure out what we want, need to know from healthcare professionals, and issues important to us, such as opinions and fears about healthcare and treatment. It also allows a safe space for healthcare professionals to share their expertise with us in a comfortable environment. Communicate. How to communicate with young people effectively. To communicate with us effectively, healthcare professionals must initiate conversation with us and treat us just like anybody else. If our parents are in the room, ask us how much we want to be involved. Remember to address us as well, as at the end of the day, it is our health that is being dealt with. Ask us questions that make us feel like we are having a conversation with you, that we are part of the conversation. Not only that, but ask us how we are feeling, how our day was. If we are in education, ask what's going on, as well as asking how our symptoms are. Also ask these questions just like you would with anybody. It develops a bond which will also make us feel more open about the more serious matters at hand. Have empathy. When talking to young people, it's not as simple as having basic communication skills like talking to us. Make sure you treat us as an individual and not as a case study or experiment for research. Be empathetic to what we are going through and listen to what we have to say. Be kind. Lastly, treat us like equals. When talking to us, ensure you don't use patronizing language that demeans us as an individual. Often, as young people, we are patronized due to our age and labeled as being inexperienced just because of how old we are. Young people living with rare conditions have to grow up a lot faster in a different way due to our health, so we know a lot more than healthcare professionals sometimes think, especially with the lived experience. So ensure when you talk to us, you don't medically gaslight our symptoms or experiences and listen to us. Here are just some ways in which healthcare professionals can communicate with us better. You can tell us certain things like relevant information in My Health and any concerns you may have, or tell us about any patient engagement groups or organizations that may be useful to us. Some questions that may be useful to ask and are important to our community is to ask us the best way to communicate with us, whether we are comfortable with our current healthcare setting or how we are feeling after an appointment. Due to our whole lives being enveloped by rare disease, it is good to show empathy and check in on us after our appointment after being overloaded with information. Involve young people in healthcare planning. Every so often, ask us how much we want to get involved in our own healthcare, as every individual is different. If we bring our parents in, ensure we have the choice to be part of the discussion or ask if we would like to be. Don't always automatically assume the parents are the point of contact just because of their authority. We may just want comfort which our parents can bring into what could be a stressful environment. We also may just not be ready because we're getting used to something we will be living with for the rest of our lives. This can be very difficult, especially at the beginning, so we may not want to have as much control in our health care at one point, but after we may have more experience and know what works and what doesn't, we may have more to say, so ensure to keep asking. Strategize with young people during appointments. Strategize with us, not for us, and show us how in the long term what we are doing will help. Having a rare disease can be exhausting, so if we know why we are taking this medication or why we have certain appointments, tests, or scans, it will help us understand a little more about our condition and what helps us. Find out the best way to strategize with us by considering how we learn. You can refer to resources or videos depending on what we prefer, which can support our understanding of what is going on in our own health. Involve young people during the decision making process. Ensure we know we are part of the discussion and get a choice in what you are telling us. There are a lot of choices we have to make for our own health, like whether we want to try new medication or treatment. Ensure we know everything there is on offer, such as the benefits and side effects, so we can make an informative decision. Ask us questions about how we feel in our own health. Previously, I spoke about how you can communicate with young people through a series of what to tell us and what to ask us. Make sure to go through some of these Ask Me questions to involve us in our own healthcare. This can be a great way for us to start conversations we may not even know to have, and will also let us think of our own questions, which will further the discussion. Direct us to patient engagement groups or useful tools. Get us involved in healthcare planning by seeing what else is out there. Whilst effective healthcare is vital for us to improve our symptoms and overall health, there are other ways too. Engagement groups can be useful in helping us find a community who are affected by the same condition. Healthcare professionals may know about our condition through expertise, but engagement groups can bring a sense of comfort and reliability, making us feel isolated. Useful tools like charities with supportive resources can also be extremely beneficial. Lastly, refer to advocacy groups. For example, we amplify the voices of young people living with a rare disease through several things. It gives us a place to open up about what we are going through and spread awareness about it to others who may not know what it's like, or to people who relate to what they are going through. Ask us how we found the appointment. Ask us whether the information you provided us made sense. This time can be stressful and overwhelming for us after you've overloaded information, so make sure it all made sense to us and whether we understood everything. Ask us whether we got everything out of our appointment, whether there is anything else we would like to discuss. Appointments are not just for healthcare professionals to let us know what's going on, but also for us to ask questions and get information out of healthcare professionals. Make sure we get everything out of it. Ask us what we would like to discuss in our next appointment so we can prepare for ourselves. And sometimes anonymous feedback is better. So if we prefer to not speak in person to you about how we thought, let us know that there are other ways to do so. Engaging young people. How to engage with young people effectively. Firstly, talk to us. At appointments, healthcare professionals should not only talk to us about our healthcare, but involve us in any way we want to and can. Listen to us. When discussing healthcare, listen to us, our questions, concerns, and opinions. Healthcare professionals may be surprised sometimes in how much we actually know about our condition when often we are deemed inexperienced just because of our age. In reality, due to our real life experience living with a rare disease, we may know more than you think, so listening to an individual experience may be extremely important, especially since every individual experiences life differently. Build a relationship on care. Whilst it is the healthcare professional's job to treat us medically as patients, it is important to also remember that at the end of the day, we are also people. Healthcare professionals should build a relationship on care, treating us like people by talking to us, have normal conversations such as asking how we are, and know more about us than just our condition, as there is more to life than what we live with. Lastly, healthcare professionals should let us be open with feelings. Living with rare diseases can be difficult as it is, so it's beneficial to consider one's mental health and how our own rare disease affects us mentally, not just physically. Signpost us to places that can help with our problems that perhaps they don't have capacity or expertise in. Let us know our options on what is available, such as therapy or psychotherapists. Reassure us there are solutions and talk us through them, whilst validating our feelings and allowing us to express them. What did some of our community say about how they think healthcare professionals should engage in healthcare? We asked on our social media platforms what they thought, and this was some of our responses. Some people said to listen, respect, and consider our needs, to not patronize us and make us feel like we are inferior, to explore various treatment options with us. There are so many things that our community would like to see in engagement, and this is just some of it. Thank you for listening. If you want to get in touch, please contact me through hello@rareyouthrevolution.com.